Hi, thanks so much for tuning in today to Lady Freethinker. Today we are speaking with Dr. Scott Weese, and he's going to answer some of the questions I think we all have about our companion animals during the coronavirus pandemic. Thanks so much for speaking with us today. I think the first thing a lot of people are wondering is, can my pet, my dog or cat, be a carrier and transmit the virus to me?
Well, there are, I guess, two important questions there. One is, can animals be infected? And then what happens if they get infected? So the answer to the first one is yes, some animals can get infected. We don't understand the scope of the issue right now. There's been not a lot of testing done is the problem. So we know some dogs, some cats have been infected. Just last night or today, there was a report of a dog in the US, which is the first one that's been identified, but it's certainly not the first dog that's been infected. It's just the first one that's been tested. So this is a human virus. But there are some species that can be spread to kind of incidentally. So I see you've got a cat wandering around behind you there. So if you're infected with this virus, just went under your seat and you cough on him or you sneeze on him or you have it on your hands, you touch them, certainly that's exposing them to it. So if the animal is susceptible to getting infected, they can get infected, and cats more so than dogs. So that's the one answer is yes, we can infect them. We don't know how often that is, but it can happen. Now, what happens with that is the big question. So from a health standpoint, cats can get sick. They don't tend to get very sick with what we know so far. Again, small numbers, but they get kind of like a mild human COVID case. They get flu-like signs. They get a bit run down, but they get over it pretty quickly. Dogs don't seem to get infected really at all. They seem to be pretty resistant to it, so they can get infected, but they don't get sick.
Mm-hmm.
Can they pass it on to us? That's the big question, and that's the one we don't really know. We know
Mm-hmm.
from a couple experimental studies, a cat can get infected, and then an infected cat can infect a cat that it's hanging out with in a cage. So the fact that they can do that cat to cat certainly raises enough risk. If you've got your cat, sticking its face in your face,
Mm-hmm.
there's the potential there. We just don't know if they've got enough virus and we have enough contact for that to happen.
Hmm. Okay. Yeah, that's interesting. So, is it possible for a pet to get noticeably sick? Like, would you notice some symptoms usually if they do have coronavirus?
Yeah, it's going to vary, and we don't know. That's why we're doing surveillance, right? So we're testing animals in households that have people with COVID to see how often the animal gets infected and then how often they're sick. So it's quite possible. If you look at people, a large percentage of people that are infected with this virus have asymptomatic infections. And that's probably the same with animals, or even more common in animals, because it's not really a dog or a cat virus, it's a human virus. So most of them probably are perfectly healthy. Cats that get sick are probably going to have a typical upper respiratory tract infection. They'll cough and they'll sneeze and they may go off their food for a couple of days. They just feel kind of run down for a few days, and most will get over it. Now, we're a bit more concerned about older cats and cats with other illnesses, just like in people, right? Your average healthy person, it can be a fairly mild disease. Occasionally, it's more severe, but we're more worried about higher risk populations. So that's something we don't really know, but I think your average cat that gets sick is going to have some mild upper respiratory illness. Your average dog that gets infected is probably not going to get sick at all. If anything, maybe mild disease. We don't really have convincing evidence so far the dog will get sick. So, and the issue with cats is cats get respiratory infections not uncommonly, especially if they go outside. But if you've got an indoor cat and you have this virus and your cat all of a sudden starts coughing or sneezing or is just a little bit run down, it's a reasonable chance it's been infected from you.
I see. Is it safe for pets to go outside? Are they at risk of contracting the virus if they do?
Well, just going outside isn't the issue, it's contact, right? So you going for a walk down the street is perfectly fine. You having contact with someone in your walk isn't. Same with the animal. So it's contacts. And what we're trying to emphasize is social distancing applies to your animals as well. So, because if you have a dog or you have a cat and they don't encounter other people or other animals, there's no way they're going to be the source in the household. If they get this virus, it's from you or your family members. So taking your dog outside is fine, but taking it out on a leash, walking it. Now, if you see someone in the park, if you wouldn't go up to that park and give them a hug and shake their hand and spend a lot of really close time with them, then don't let your dog do the same thing. If the dog goes up and they cough on it or they pet it or it licks their hands or their face and it comes back and does the same thing to you, we've basically done the same thing as maybe going giving them a hug. So animals having time outside is great, but we want them to be distancing while they're doing that. So that means outside, under control, and kept away from people.
I see. So is it then possible for someone to have contact with a sick animal And then if they have contact with you, can they transmit it to you? Are there any known cases of that?
Well, so the animal is so there are a couple of issues there. One is that the animal's hair coat can get contaminated. So if your cat has COVID and they've been grooming themselves and they deposit some of the virus on them, or if you have COVID and you cough on your cat and you've put virus there, we have no idea. Like the virus doesn't survive very long outside of the body. And some surfaces, plastic and stainless steel, 2 to 3 days, it's survived in lab conditions. But our cats aren't made of stainless steel or plastic, so it's a little different scenario. We don't really know how long it survives. It's probably minutes to hours on the hair coat. So, but we can't say no, but we don't think it's a big deal. But again, that's why we try to keep animals separate. So if you're infected and you cough on your cat and you deposit virus on your cat, if it runs next door and sticks its back in your neighbor's face, well, maybe you've just done the same thing as touching your neighbor's face indirectly. It's probably a fairly low risk thing because the virus doesn't survive very well and you're not putting a lot on them. But again, it's something that we can address through some common sense and keeping the animals inside and some hand washing. So that's why we want to do that until we know one way or the other.
Right, right. So just in general, do you recommend that other people not pet your animal or have contact with them?
Yeah, for now, it's social distancing, right? So again, if I wouldn't want them to touch my kid, I don't want them to touch my pet. It's just easy to do in the short term. We're not talking forever, but we're trying to contain this pandemic and we're trying to sort out the issues as well. Like hopefully in a few months or as time goes on, we'll know more about how often animals get infected and whether we can contaminate their hair coat and whether that poses a risk. And it's better to use common sense things that don't really compromise your life and your animal's care for now, just to make sure we're preventing a problem. What we want to do ultimately in taking care of this in animals is keep it a human disease. We don't want to bring in an animal dynamic. So the more we keep animals removed from it, the better for them and for us.
Right. Yeah. Sorry, my cat is very needy. Oh, come here, sweetie. Okay. Yeah. Sorry about that. She decided to cry. Um. So one last question. Do people still have access to vet care?
And that, yes, there'll always be some access to vet care. It depends on where you are. So in Ontario, where I am, veterinary medicine is considered essential, and that's, I think, fairly universal. It's considered an essential service. Within that, though, we're directed just urgent care. So if your animal, is a life-threatening problem, it's hit by a car, it's got an acute abdominal thing, it might need surgery. If it's got a chance of dying or having a serious disease, or it's in a lot of pain that we can't control, then we absolutely see it. What we're trying to do is reduce elective things, doing things by telemedicine, a lot of things we can sort out. So if you have an issue with your cat, say let's say your cat is coughing or sneezing or whatever. So we can do this as we're doing now. How's your cat doing? I can take a look at it. Yeah, cat looks pretty good. Maybe we just need to give it some time. Or if we need to try a drug, okay, you can come pick up some medication at the clinic without having contact with us. So we can do a lot of veterinary care without actually having to lay our hands on the animal, at least for now. And what we're trying to do is delay things a little bit. So maybe we don't need to see him now, but we can see him in a month and we can maintain things. So yes, you'll have access to veterinary care for things that need to be done right now. It's made us change how we do some things, like delaying some vaccinations and delaying some things like spays and neuters because they're not urgent in most cases, but the critical care will get done.
Oh, that's interesting. Telemedicine for animals. I'd
Yeah.
never thought about that, but that's a great solution. Okay, well, those are all my questions. But in general, do you have just any advice, general advice for pet owners who might be concerned about this?
I think a lot of it's relaxed, really. Like if your dog or cat has COVID, they got it from you or your family member if you're doing social distancing, right? So that means so if my dog's infected, I'm already infected probably because I gave it to him, or someone else in my family is infected, and I'm more likely to get it from them than from him. So if I keep him away from other animals and other people, he can't bring this virus into the household. So I'm a risk to him, and he's not a risk to me. So it's common sense. It's social distancing. It's basic hygiene things. It's relaxing. It's treat your pets like your family. So if you're trying to keep your kids or your spouse or whoever inside and away, let's just do the same thing with your animals for now and consider us as one household unit, not the people and the animals. We're all in it together.
Yeah, that's great advice. Well, thanks so much for talking to us today. I really appreciate it. I think our viewers will learn a lot and hopefully have some of their fears eased. To everyone watching, thanks for tuning in. Check out the rest of our content on ladyfreethinker.org and follow us on social media at Lady Freethinker. Thank you for watching.